If you're someone who takes methadone or buprenorphine to treat an opioid use disorder, I want to hear what it was like for you to actually find the person to prescribe that medication or the clinic where you pick it up. Because back in March, researchers at UPenn published this secret shopper study, which I found really interesting. They called a little over 100 people looking to get buprenorphine prescriptions. About half of them were specialty addiction clinics, and half of them were primary care doctors. Almost all of them had appointments within the next few days, which is a really positive thing. But that might be where the positives of this study end. When they started asking questions about what the treatment would look like and what it would require, the people who picked up the phone didn't have answers for them. For example, they couldn't tell people whether or not they'd actually be able to get buprenorphine during that first office visit. They also often couldn't tell them whether or not they'd be required to go to counseling in order to get the buprenorphine, or if they would lose it if they didn't remain completely abstinent. The researchers wrote, "This is essential information for a patient who's seeking care, especially if they've recently suffered a non fatal overdose. And it directly affects their ability to access treatment quickly and remain in treatment." If you've never seen me before, I'm Emma. I'm a science and medical journalist, and I'm especially interested in medications for opioid use disorders. If that's something that's interesting to you, be sure to follow along here and check out my Substack.